Hello, guys. My name is Dr. Nkiruka Bridget. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health. So, if you are new to my channel, you are welcome. So, guys, I had to steal some time out from surgeries to do this.
Let me see the stuff. Let me see the video. I will download it as an app.
I don't know. I've discussed a lot of videos, discussed a lot of topics, but I want us to discuss hyperprolactinemia. How much do you know your body? When a young lady that is not breastfeeding starts seeing breast milk discharge from her body, it's known as hyperprolactinemia. It's actually known as galacturia. But when we now do the test for hyperprolactinemia, we find out most times that there's prolactin, that's the hormone responsible for breast milk, is high. And for some women, that may just occur on its own. For some others, it may be associated with other conditions like polycystic ovarian disease. And most times, those women having such conditions do not ovulate. Why they do not ovulate is because the body is seeing it that the person is breastfeeding. It's the literal meaning to it. The body is seeing it that this person is breastfeeding, and so we don't want pregnancy to occur. So most times those women have what we call anovulation. They don't ovulate. But when you evaluate such persons in the hospital, you'll find out that the person is having, from history, then examination, the person is having breast milk discharge, and you do investigation, it shows you that the person's breast prolactin is high. So that will help you to treat the person. There are lots of drugs we use. The commonest we use is what we call bromocriptine. Though the drug is with side effects. However, that's the first thing we do. We also encourage the person that if the breast is being sucked, the person should stop for the meantime, so that the body will not be giving the notion to the brain that the person is breastfeeding. Now, when you give drugs to suppress it, most times the person gets better. There will be you will not feel the breast milk discharge will stop. So the breast milk discharge will stop. We're actually talking about hyperprolactinemia. I don't know who is here with me. You can just say hi, drop hi on the comments chat. So the breast milk discharge will stop. Hyperprolactinemia affects both young women and can affect women of reproductive age. The breast should be examined. When it starts bringing out milk, we suspect that it's hyperprolactinemia. If it starts bringing out something greenish, it could be breast cancer. We call it ductal cancers of the breast. It may start bringing out blood. It's also a sign that there's a disease going on, which is specifically maybe breast cancer. But when it starts bringing out milk, it's possible that the person has hyperprolactinemia. Franny, you are welcome. Thank you, Franny. I love your videos, ma. Thank you, dear. I'm so grateful. Thank you. Just help me share them. I still need these videos to get to the targeted audience. Thank you so much. And please, always, whenever you drop by, drop a comment. Thank you. So the person will be discharging breast from her breast milk. And what we'll do most times, we evaluate the person. For women that are in their reproductive age, trying to get pregnant, when we stop that breast milk discharge with the use of drug, she will start ovulating. Her ovulation will get back to normal. But if for any reason we try the first line of drug, it does not work. Most times the first line of drug we use is bromocriptine. It has doses. We increase this sequentially. That's why the person should not take it on its own. Then if that does not stop, we'll we'll move to the next one, we'll call it carbagolin. However, bromocriptine is taken daily. However, carbagolin is not taken daily. You can take it up to 3 times in a week. So we'll alternate the way we give it to the person. But the most important thing is that to advise the person on lifestyle modification. That's if she's breastfeeding somebody, maybe an adult, would encourage the person to stop so that the breast milk discharge can stop. Sometimes it can occur on its own, that is just on isolation, you just notice hyperprolactinemia. But most times it occurs with polycystic ovarian disease. The ovaries are filled with cysts. The cyst will not allow the ovaries to release an egg. So most times those people suffer what we call oligomenorrhea. Oligomenorrhea means that their menses are longer than 35 days, their cycle length. Remember I said initially that the normal cycle length is between 21 days and 35 days. Anything below 21 days or above 35 days is not normal. So most times they have what we call oligomenorrhea. In that oligomenorrhea, the uterus just grows to any point it likes and shed. So that's what happens in such patients. Friendly, you are back. So the person will just be seeing her menses. She has also what we call abnormal uterine bleeding. So the body just sheds whenever it wants, because the endometrium where the baby is lying has overgrown its blood supply, and the next thing it sheds. And most time when it sheds haphazardly. When the person now visits a doctor or comes to the hospital, we evaluate, do an ultrasound and see the level, how the uterus is doing, and we can take over the menses and correct it. So these are what happen in patients with hyperprolactinemia. It is a correctable disease. If you go outside, they will say it's hormonal imbalance. Actually, it's just that hormone, but it can coexist with other conditions like polycystic ovarian disease. So that's that about hyperprolactinemia. Then it can lead to anovulation. That hyperprolactinemia can actually lead to anovulation because the body senses that the person is breastfeeding and wouldn't want the person to get pregnant. So someone that is not breastfeeding and having breast milk discharge should consult a gynecologist so that the appropriate investigation is done and the treatment given. Friendly, are you the one back? Please, if you are the one, just drop a comment. If it's another person, please just drop a comment. Thank you. Just help share my video, subscribe if you are not following me. My name is still Dr Nkiruka Bridget. I've discussed how to calculate someone's ovulation time, when to know the safe period and when they are not period. I've also dropped a video this morning on tips on how to get pregnant. If you want to get pregnant today, there are things to do to make you get pregnant today. And one of the things to do to get pregnant today is frequent sexual intercourse. Someone that is trying to conceive, we don't advise the person to live separately from the partner. That's one. Secondly, we advise the person to, as much as possible, have frequent sexual intercourse at least 3 to 4 times a week. We want it interspersed within the week. We want the reproductive tract to have a sperm always available. So please share this video, like, subscribe to my page. We'll also encourage the person to have sexual intercourse close to ovulation date as much as possible. When someone that is trying to conceive, we don't advise you to have sexual intercourse when it's not we don't advise you to avoid sexual intercourse during your ovulation period. At that ovulation period, we advise you to have sexual intercourse as much as possible. Sometimes your ovulation period, if you have a 28-day cycle, means you ovulate at the 14th day. So between the 10th day of your cycle till 18th, 20th day, we advise you to be sexually active with your partner. We want the day it will click, you may not know, especially for those that are trying to conceive. Then we also advise you to change some lifestyle. If you are obese, we want you to reduce weight. If you reduce weight, most of the things will correct in itself. Someone that that has polycystic ovary that causes her not to ovulate. If the person reduces weight, most times you will just see that sporadically she ovulates. If she can reduce up to 5 to 8% of her body weight, she will sporadically ovulate and get pregnant even without medication. Then, so lifestyle, we advise the person to change her lifestyle as much as possible. Then we also advise the person to not to do over exercise. We don't want you to do rigorous exercise. An exercise of about 3 times in a week, about 30 minutes aerobic 3 times a week is enough. We don't want you to be underweight, we don't want you to be overweight. We don't want you to stress yourself so much, because there's a way you stress yourself, the body will interpret it that you are stressed and may not be able to carry pregnancy. And what does the body do? The body will shut down and it may not even ovulate. So those are the things that I've come to discuss. If you have not followed my page, please follow my page, subscribe to my YouTube page right now at Dr Nkiruka Bridget at OBGYN Talks with Dr Adazion. I always discuss health, mostly health. So if you passed by, just click a like, hit the notification button so that next time I'm going live, you will join me. Thank you, thank you, thank you, thank you.